Can hyoid suspension surgery be repeated? Have you ever wondered if hyoid suspension surgery can be performed more than once? This question is important for those considering surgical options for sleep apnea. Let's break it down. Hyoid suspension surgery is designed to treat obstructive sleep apnea by repositioning the hyoid bone. This helps open the airway and reduce blockages during sleep. It is often part of a broader surgical approach that targets the hypopharyngeal region, a common area for airway collapse in moderate to severe obstructive sleep apnea. Now, when it comes to repeating the surgery, there are several key points to keep in mind. First, hyoid suspension is generally considered safe and minimally invasive. The procedure usually involves a small incision and can be completed relatively quickly. One of the standout features of this surgery is that it is reversible. This means that if necessary, the implants or sutures used can be removed, allowing for further interventions if needed. The effectiveness of hyoid suspension can vary. Studies show success rates ranging from about 17% to 78%. Success is often measured by a significant reduction in the apnea-hypopnea index, which indicates the severity of sleep apnea. Patients with moderate obstructive sleep apnea tend to see better results. However, not everyone achieves complete relief of symptoms after the first surgery. So, can you have the surgery again? While direct evidence on repeat hyoid suspension surgeries is limited, the fact that the procedure is reversible suggests that a second surgery could be technically feasible. If the initial surgery did not sufficiently improve airway function or if symptoms return, a repeat procedure might be an option. It is also important to consider patient selection and anatomical assessment. If a patient's airway structure changes, or if the first surgery was only partially effective, a repeat surgery or other surgical options may be explored by the surgeon. Additionally, hyoid suspension is often combined with other procedures, such as uvulopalatopharyngoplasty or genioglossus advancement. If hyoid suspension alone does not provide enough improvement, these additional surgeries may be included in the treatment plan. In essence, hyoid suspension surgery can potentially be repeated, especially since it is reversible and minimally invasive. However, the decision to perform another surgery depends on individual factors, the outcome of the first surgery, and a thorough evaluation of the anatomy. Repeat procedures should be carefully considered within the overall management of obstructive sleep apnea, often as part of a multi-level surgical strategy.